Trauma affects a large portion of the population. It is not a rare occurrence. Many people have experienced some form of trauma in their lives. Statistics show that 1 in 5 American women are sexually molested. Men experience trauma too. Childhood trauma is also common. Studies show that 4 out of 5 children experience physical abuse from parents. Furthermore, 8 out of 10 children witness violence between their parents. These experiences have a lasting impact. Trauma is not always a single event. It can be ongoing abuse, neglect, or exposure to violence. Living in poverty, experiencing racism, or facing discrimination can also be traumatic. These experiences create a constant state of stress. This chronic stress changes the way the brain and body function. The impact of trauma can be felt for years. People may not even realize that their current struggles are connected to past trauma. They may struggle with relationships, work, or emotional regulation. It is important to understand how common trauma is and how it can manifest. Trauma is not a sign of weakness. It is a normal response to abnormal events. It is crucial to approach trauma with understanding and compassion. With the right support, healing and recovery are possible. Trauma affects both the body and the mind. When we experience a traumatic event, our bodies go into survival mode. Our heart rate and breathing increase. Stress hormones flood our system. This is the fight or flight response. It helps us survive in dangerous situations. However, when trauma is repeated or prolonged, this system becomes overloaded. This constant state of stress can lead to physical health problems. These include chronic pain, sleep disturbances, and digestive issues. Trauma also impacts the brain. It can affect memory, emotional regulation, and our ability to form healthy relationships. Trauma can make it difficult to manage emotions. People may experience flashbacks, nightmares, and intrusive thoughts. They may feel emotionally numb or detached from others. Hypervigilance is also common. This means being constantly on alert for danger, even when there is none. These responses are the body's way of trying to cope with overwhelming experiences. They are not signs of weakness or mental illness. They are natural reactions to abnormal and stressful situations. There are many misunderstandings surrounding trauma. Traditional mental health approaches often fail to address it effectively. They may focus on symptoms rather than the root cause. Medications can help manage symptoms but do not heal the underlying trauma. Societal factors can contribute to trauma and hinder healing. Poverty, racism, and discrimination can create chronic stress and increase the risk of experiencing trauma. These factors are often overlooked or minimized. It is essential to recognize the role of these systemic issues in perpetuating trauma. Addressing social injustices is crucial for creating a society where individuals feel safe and supported. We need to create systems that prevent trauma and provide effective treatment for those who have experienced it. Effective trauma treatment focuses on understanding and addressing the root causes. It recognizes the impact of trauma on both the body and the mind. Safety is paramount in trauma treatment. Survivors need to feel safe and supported to begin processing their experiences. Body-focused therapies such as somatic experiencing can be helpful. These therapies help release trauma stored in the body. Talk therapy can also be beneficial. It provides a safe space to process emotions and develop coping mechanisms. Self-compassion is essential for healing. Trauma survivors often blame themselves for what happened. Learning to treat themselves with kindness and understanding is crucial for recovery. Trauma treatment is not a one-size-fits-all approach. It requires a personalized plan that addresses individual needs and experiences.